Okay, so the next trick is going beside the vein, not on top of the vein. Now, the reason for going beside the vein is that sometimes the skin can be tougher, especially with some people that may have outdoor jobs or jobs that are physically strenuous. The skin can sometimes be a bit tougher, also genetics. So by going in on the side of the vein, when you go to push and press down, the skin won't flatten the vein for you. By going in on the side, you'll maintain the height of that vein, and therefore you're going to give yourself the best size lumen to cannulize. So move right beside it parallel. You're going to turn your needle just a little bit and then advance forward. Once you know you're in, you can pull and cannulize. Now say that you're lost or you're unable to find or cannulize the vein and you don't have a wonderful arm like this. Things you can do is take the needle. If you're not able to find the vein, what you're going to do is you can actually pull up on the needle just a little bit by flexing it and putting your finger right where the tip is. And through the skin with your finger you'll be able to feel the tip of that needle. Then once you know where the tip is, feel where the vein is in relation, and then guide yourself with that needle. And continuously check, just pull up just a little bit with the skin. You won't cut or move anything inside, just enough to know where the needle is compared to the vein. And that will help you find your vein. You may even find that the needle's underneath, and so you'll feel something squishy, slightly firm, and then the needle, because it'll be moving as you flex it. So pull back, feel above again, then you'll feel the distinct hard piece of metal, and then you'll feel the vein beside it, and then try again. And this technique really helps you find that vein as opposed to just doing a sawing motion and hoping to get to it. So it's just a little flex and pull upwards to feel it with your finger, and then direct the needle on wherever the vein might be in relation to the tip of that needle. Final bit for going on the side and not going on the top is that a lot of nurses typically, once they find their vein, they're going to go straight down on top of it, and so you may have a lot of scar tissue running along the top of the vein. However, most nurses don't go in on the side or underneath, and so if you're having difficulty puncturing through, or you are stabbing the vein and popping right through it, getting a little bit of flashback just for a quick second, like a ring, then you've gone through the vein. If you end up going through the vein for whatever reason, your best bet is to leave the cannula in place, and what that does is it actually plugs the hole for you. And if you've gone through the vein and you have just a bit of blood, removing the needle, you won't have any blood coming back through. It'll actually secure the vein to the tissue, and you'll actually have less rolling. And so then you can take the next needle and go above your area. Now that the vein is completely pinned down to the epithelium, you'll now have the ability to start higher up, go into the vein, and it won't move whatsoever for you because you've pinned it down. And then once you've got it in, cannulize the vein, attach all of the equipment or extension sets that you need, and then you'll have to press down on this one afterwards because it will bleed because you did pierce it. Okay, I hope that helps. Marking on your needle is going to help you in the long run. If you have to pull the needle out, you're in beside the vein, you can't find, you're in a sawing motion, or you're trying to figure out where to go next. To reduce the amount of trauma that you're causing inside the tissue, what you want to look for is that little window right there. That's the window you're looking for when you remove it and pull your needle all the way back. I usually say to people that that's the area where the plastic is full, and you know that any farther and you'll be completely out of the skin. Although it's never recommended to do that kind of sawing motion. Some of us have to do it sometimes to get that vein. But the window is your landmark to tell you where to stop. This is clamping down a vein so that blood doesn't start to pour out from your IV because you want to attach your extension set. So once you're in and you're about to remove the needle, this is how much plastic could be potentially in the vein depending on when you punctured it. So what you want to do is you eyeball where you think the end of the plastic is, the cannula, and you're going to press on the vein. And I like to use 3 fingers. That way I've got this much surface area to block the pressure that might be coming at this, and it will reduce the amount of blood that will come and drip down the side of the arm and ultimately make it a cleaner stick.